and encouragement over the years, we would definitely not have a program at all. So thank you so much to my FARMacy West Virginia planning team. Amanda and I extend our gratitude dramatically. So thank you, and let's go ahead and we'll move on.
So this is the syllabus of our talk today, and hopefully we'll tell you what we're going to say and then say it. We're going to review for everyone who's on the call that's new and you're looking at starting a FARMacy West Virginia program in the coming year. We want to just reiterate our mission statement and let you know what our intended goals are and what we've seen as a resultant of what we've been doing in implementation across the state. We do have an update for those who are already running pharmacy programs regarding implementation and processes that are going to change slightly, but not dramatically. We're going to let Gina give a few slides about the way education has been deployed across the state and what our goals are with that curriculum. We have already the way that REDCap, I hope that you guys have found that system. We've got a lot of positive feedback over the course of the past year on data entry and input, and Andrea has been incredibly helpful. So she has some slides to share regarding presentation of data from the past season. We're going to briefly discuss funding and then just give you an update on what our long-term goals are, the advances we've made within the course of the past 12 months, and what we're looking at for the next 12 months. Next slide. So just grounding ourselves before we begin, we have an intended purpose. We know the health metrics of West Virginia are tragic. We know that poverty and nutritional insecurity overlap and cause health disparities. So our goal is to provide improved access to nutritious, ideally locally grown food. We want to also overlap that with basic nutrition and cooking skills, which we believe helps prevent and treat chronic disease in West Virginia. So we're coming alongside what already is happening in communities across the state to make this real. Next state. We have 4 pillars to our program. These are what we base why we do what we do and how we roll out our programming. We know that access to affordable, fresh, ideally locally grown produce is a missing piece for the health of West Virginians. So we want to provide access. We want to equip people with education that they need to make not only nutritious food, but the culinary skills to prepare that food. We know that a strong patient-provider relationship secures and guarantees success of that person's ultimate health goals. And we know that even though we find this program successful and we're not reinventing the wheel, the help with the Office of Health Services research lets us collect health metrics.
That's a lot of it, and I don't agree with everything either.
Thank you. I think the health metric collection piece is this year, it shines brightly. We're able to see and extrapolate a lot more details associated with success of giving people fresh food. Next slide.
So let's discuss how FARMacy West Virginia fits into the national food as medicine movement, which really continues to grow and expand across the country and into 2025. FARMacy West Virginia is really just a small piece of the food as medicine movement in the state of West Virginia. So what you're seeing right now is the national, what we use nationally as the food as medicine pyramid. And it's basically an illustration of the food as medicine programs which exist in the United States today. If we start for the bottom and you look at the lower 2 bars, these are population level food programs, and they include programs like SNAP and WIC and emergency food programs. And you'll see that these are mainly provided for prevention of chronic disease. As you move up to that 3rd bar, that's where FARMacy West Virginia falls. It's essentially a produce prescription program, and it's meant to be for both treatment and prevention of chronic disease. The top 2 bars are basically designed for treatment of chronic disease. Those are medically tailored groceries and medically tailored meal programs. And they're geared towards specific disease states. And oftentimes are delivered to the patient, patients that are chronically ill, patients that are post-op, patients that are post-hospitalization, and who have difficulty leaving the home or are homebound. And they're basically, like I said, made for more of a treatment-like versus prevention. Next slide. This is the diagram of the FARMacy West Virginia program. As you can see, it's a patient-centered program. Patients are selected who meet 2 eligibility criteria. 1, all patients must have at least one chronic disease, and our target being type 2 diabetes. And also they must have food insecurity, which can be documented in the home. So patients are selected by their medical providers and are given a written prescription for 1 week's supply of fresh produce weekly for 15 weeks. The provider continues to support the patient throughout the program. The prescription actually validates to the patient that healthy food is medicine. The patient takes the prescription every week and exchanges it for locally fresh grown produce at about $25 per week. And it's all presented in a farmer's market style pickup at the medical facility. This allows interaction for the patient with the farmers and growers that are present at the pickup, so they can learn more about how the produce is grown. Last but not least is the early introduction of education, and it's in the form of basic nutrition and culinary instruction. This starts usually within the first 2 to 3 weeks of the program and continues on for about 9 weeks. We have in West Virginia used the West Virginia University Extension Family Nutrition Program for the educational component actually over the last 10 years. Since we have an Ohio site at this point, we are using the OSU Extension Celebrate Your Plate program, which has been used for basically the Ohio sites and will be continued to use for the Ohio sites as we progress there. Next slide. Let's talk a little bit about the FARMacy 2025 implementation and how things have changed and how things have remained the same. So our first thing is what we say every year: you need to start recruitment early. That's the part of the program that takes the longest amount of time. So start now with recruitment of patients. The eligibility form is still on the website under forms. Use this as a guide for the selection of patients. The eligibility form has not changed. I'll emphasize that at this point. It has not changed. The criteria remains the same. So the patient must have 1 or more chronic diseases as listed on that eligibility form. Again, we target type 2 diabetes, so that's important to remember. And also the patient must have food insecurity that we can document in the home. Next slide.
This will serve as a change. If you were a participant in years past, including last year, we printed the forms and sent them to you in a rather large package. And we're not going to print the forms this year. There are a lot of reasons. One is the cost of that, but the other is we additionally didn't have always the right numbers. So in just trying to be wise and good stewards of the finances we have, we're not going to print them, and you're going to be able to print those. They've always been on the website, and they're very easily accessible in PDF and downloadable, easy to print from that About tab, and you'll see each form is available there. Next slide. The other piece that going forward, we're going to ask in the end of the program, we have some next steps which outline this more clearly, but we're going to ask that each individual clinic and site email us with their desire to host another program or host a new program, and then we'll work on establishing programs. We're going to work with pilot programs first. Those are the new programs that many of you we've met and talked with already, but we want to try to allocate what resources that we have already reserved for new programs and begin getting them a head start in their, all of the pieces they need to get started to make that happen quickly. So we'll be meeting with new programs and then following up with everybody who desires to continue to expand. And our ideal situation with these meetings is that we have the site coordinator, the medical liaison, that person who is going to, and sometimes these roles overlap, we understand that. The person who's kind of the clinical coordinator, the boots on the ground person, the one that's entering the data, the one who is calling the patients for follow-up, helping getting the forms completed. Ideally, we'd love to have the providers on the call. This is important to us in that as much as the reach of our mission and desire to impact the health matters, that the providers are on board with that that mindset and that effort. So we're asking that the provider, at least one participating provider, be included in at least the initial call. We want the farmer and grower to be a part of that initial call so that everybody knows everyone, and we can line up things like when drop-off is going to occur and how do we want the produce delivered and what do we need, do they want boxes back, and those little nuanced pieces that matter to make things run smoothly. And we'll have our educator. In some instances, that's more than one person. In some instances, we might not have a person designated for that county yet, but we want an educator in the instance that you know and have someone recruited, or we can help you find that person also involved. So that first meeting is going to be a real big group, and we're excited about that because in some of our kind of reflections on why programs struggle or why things weren't as successful in one place versus another, these pieces weren't all in place. So it takes an intentional effort to make this happen, and it doesn't all fall to one person. So we're emphasizing and advising that these meetings, and we want to kind of give preference to those sites that have these pieces in place so that we can really iron out and get things lined out to be more streamlined and successful. And again, we'll follow up at the end. You can go to the next slide, but there's a next steps that we'll talk about at the end for more of that logistical piece. We intend to, and I think if you were participating last year, we had a regular frequency of following up, and we're going to continue to do that, especially in the beginning stages. Once the programs get started, as you know, that energy is kinetic and it sort of moves through the summer, and we can troubleshoot things as they come up, but we really allow that autonomy to fall to the sites to run and however you want them to look. But we're going to try to do biweekly check-ins with those host sites. Our role as FARMacy West Virginia is to help set up and implement as much of this program and to not make this a stressful endeavor for you or the clinic. We want to help with all of the data collection and entry issues. As you know, if you participated last year, Andrea had an excellent tutorial. You were very accessible to the WVOHSR group, and hopefully you found that helpful. But if you need trained in REDCap, it seems to be a fairly easy on-ramp there. So we have contracted with them, and we'll be utilizing them and REDCap services again for the 2025 season. So if you were okay with it this year, no changes there. And in those meetings, our goal is to discuss each individualized site progress. So when we have those midway data entry points, hopefully we can be circling up and telling you like how well that is going for you. Next slide.
All right, looks like I'm up. So hi everyone. It's good to see some super familiar faces and meet some new folks here. I'm Gina Wood. I'm one of the co-directors of the WVU Extension Family Nutrition Program. And just to give you a little overview of, kind of who we are and how we operate, our program is actually 100% federally funded by the USDA. A lot of you have heard of SNAP Ed, which is the educational outreach arm of the SNAP program. And there is a sister kind of program called FNEP, Expanded Food and Nutrition Education Program. So the USDA funds WVU Extension directly for these programs. Our mission is to provide nutrition education and obesity prevention outreach to low income and limited resource families across the state. And those funds enable us to provide our programs and services at no cost to anyone. And that includes participants of FARMacy West Virginia, where we're able to do that. So this is a map of where our staff are located. So we do have about 46 positions that we fund throughout the state. They cover almost the whole state with a couple of gaps, which you'll see here in red. We do have educators available in most counties currently. You'll see we do have some vacancies. We have a few positions that we plan to hire hopefully over the next few months. But there are some nuances here as well. Because of the different funding sources between FNEP and SNAP Ed, some of our educators are youth serving, some of them are adult serving. So just because you see a county covered in blue here, doesn't mean that there's an educator for this specific program. And, Amanda and Dr. Carroll were alluding to that earlier, but we do our best to make sure that pharmacy programs are covered as much as we possibly can. If we're not able to provide education, perhaps we can brainstorm together about ways that might be able to be provided. We do have online education available for, counties that we don't have an in-person educator. So if you have participants who need online education, we can provide that. Otherwise, like I said, we can help you brainstorm. So yeah, Audrey, if you want to move to the next slide, that would be great. So the program that we provide for most of our adult participants, including pharmacy participants, is called Eating Smart, Being Active, which is a program out of Colorado State University. It is a series of 9 lessons. It's based around the dietary guidelines for Americans and My Plate. A lot of you are familiar with those kind of key messages that center around diet quality and physical activity, food safety, food security, and food resource management. So those are kind of the key messages that we focus on throughout the duration of the program. But because this is a pharmacy program, we do really, I guess, take extra care to highlight the fresh produce that's being provided to participants through the program and focus on education around how to use that produce in the most helpful way possible. All right, next slide, Audrey. So the education that we provide is very hands-on. It's very interactive. There is a cooking component with every lesson that we offer. So participants are actually getting their hands dirty, literally, doing the cooking, doing the chopping, doing the measuring, all of those things. And along with these programs comes a lot of discussion, a lot of interaction, and we find that that's how adults learn best. We also provide some educational enhancement items, small kitchen tools. It could be measuring cups and food thermometers and things like that to help people to help them make healthy meals at home. For those who complete the program, we do offer a graduation certificate and a cookbook. The graduation certificate might seem insignificant to some people, but for our participants who may or may not have had a lot of formal education, it's really highly valuable to them. We do pre and post assessments of behavior change, and unfortunately, there is some duplication with the pharmacy pre and post paperwork, but because we are federally funded, we have to collect data that's a little bit different and separately from the pharmacy program. So I just wanted to make that clear up front. Our priority population for FNEP and SNAP Ed is families with young children in the home or adults who otherwise have the responsibility of feeding youth. So that could include grandparents with grandkids or any adult that has some responsibility for feeding youth. So that's just a little bit about our program. It's a little bit of an overview of the curriculum that we use and who we prioritize for recruitment in our programs. If you have questions, my contact information is here on the slide. Feel free to reach out to me anytime with questions about availability of our educators, a lot of whom are here on the call today, or other questions that you have about our program or the data collection that we do with our program. And with that, I'm just going to turn it back to Amanda and Dr. Carroll.
Thank you, Gina. So we're going to continue with standardization of the FARMacy West Virginia 2025. In other words, the look of the program. We'd like to keep it consistent and standardized again. We just started with that in 2024, and we'd like to continue on into this year. We did provide last year a marketing package for all sites. We are going to do that again for all new sites. The marketing package includes posters for recruitment. They're used to hang in the exam rooms, waiting rooms, and anywhere it's visually possible for the patients to see those. We have informational bifolds, which are wonderful for patient information, for provider information, gives a basic overview of the program and how it works. We have vinyl banners for produce display during the pickup time of the program. And we have produce bags, which are reusable for all the patient participants. And we do supply produce bins and small chalkboards for delineating the vegetables and how many the patient is allowed to take on a weekly basis. We have those available for sites who need them. And also we have the FARMacy branded prescription pads, buttons, and pens, all of which everyone received last year and will be able to receive again this year. Next slide. So we realized that some of the things that we sent last year will need to be restocked. So for programs that are returning, we have several items in the marketing package for you. We'll restock the reusable produce bags, the prescription pads. Certainly the informational buy flyers will go out as soon as possible. And then again, we have tons of buttons and pens that we'll restock for you. And if there's anything that you need that I didn't mention in this slide, please let us know and we'll help you to get some of those. Next slide. So a little bit of an update on the funding for 2025. FARMacy West Virginia remains a 501c3 nonprofit charitable organization. We have Aetna funding available from 2024 for a limited number of 2025 pilot programs. And a pilot program is defined as 15 patients or less. So we have limited funding for those, and we have reached out to a lot of you already who reached out to us about starting pilot programs. So we will, in the future, get together and decide who is going to have a pilot program. Aetna funding is available for programs funded in 2024 at the same patient number. That's important. We still have the data sharing agreement with Aetna, and it's still in effect for 2025. We will again have deadlines for data entry, which we haven't decided as of yet, but I'm sure it'll be very similar to 2024, and we'll discuss those at a later date. We have limited funding available for community champions or the medical liaison position. It's remaining from the Specialty Crop Block Grant through the West Virginia Department of Agriculture. We have funding to fund eight of those positions, only 8 this year. And of course, we have the Mary Jane Brooks Charitable Trust funding available for 1 returning site in Ohio and 2 new pilot programs in Ohio. So this funding is designated for only Ohio sites. Next slide. Okay, I'm going to turn this over to Andrea to discuss the data for 2024.
Thanks, Dr. Carroll. Hi, everyone. It's really good to see all the familiar faces and new faces. So I'll take a few minutes to go over the data for 2024. If you're a new program for 2025 and you're not familiar with REDCap, it's an online HIPAA compliant system for collecting data. 2024 was the first year that we started using REDCap. I think it went really well. Everyone seemed to have a pretty easy time with getting familiar to the system, learning how to use it, being able to take a look at the dashboard of all the participants that you have and seeing what data was missing, keeping track and timely data entry. And then these dashboards that we're looking at today, we are able to make a direct connection from the dashboard to the data in REDCap. So it allows for pretty timely outcomes reporting, which is nice as well. So this first static image that we're looking at from the dashboard just shows a program map. So down below, you can see a county map. So that's highlighting the counties where there are pharmacy programs. And then the orange dots are the towns and cities where participants were coming from. So I believe that's 26 total counties that we have covered with FARMacy, which is amazing. Up top, you can see some of the eligibility criteria that we had. So across all programs, about 52% had diabetes. Nearly 16% had prediabetes, 49% were obese, almost 60% had hypertension, and then 50.5% had hyperlipidemia. So we can go to the next slide. Up top here, you can see that we had a total participant reach of 857 participants for 2024. That's amazing. And just a quick overview of the demographic profile of those people. Majority were female, which is something we commonly see in programming. So almost 67% of participants were female. Majority were white, non-Hispanic. Most of the participants were retired or on disability, or were unemployed. They were older, so majority of participants were 55 or older. Most had a high school diploma or equivalent, and most of them were on Medicaid or Medicare. So I don't think that we have any surprises there. That's what we all expect for the pharmacy program. Next slide, please. So here we're starting to look at the pre-post outcomes. So the way that this is set up is that they're matched for pre-post, meaning that the only participants that are included in these views are participants that had data for both time points. So we're able to see change for those participants. So as we look through this view, this is the food environment dashboard. You can see over on the left is the pre, so that's the 12 months prior to the program. And then on the right is post, so 3 months during the program. So you can see some really nice outcomes here. So the second one down, we have percent of people who said it was never true that they worried about their food running out before they had money to buy more, increased by about 4%. That's amazing. Down a few more, we have how hard was it for them to regularly get and eat healthy foods? That was a really nice improvement. So the percent of people that said not very hard or not hard at all increased quite a bit. You can see not hard at all increased from 22% to 27%, and not very hard increased from 17% to 28%. So really amazing. And then down at the bottom, you can see that their confidence with their basic cooking skills really increased as well. So those who said they're somewhat confident or very confident increased, let's see, by about 7%. So that's great. All right, next slide. Okay, so here we're looking at food habits, and really across the board, you can see that participants are eating healthy foods more often and eating unhealthy foods less often. So the percent of people that said they ate fruit at least once a day increased. More than once a day went from 11% to 17% once a day, 22% to 27%. So that's really great. They're also eating colorful vegetables more often, dark green vegetables more often. Fast food decreased quite a bit. So you can see I swapped the color scale here. So look down at the bottom at the green, not at all increased, and once a week or less increased by 10%. That's really amazing. So people are eating unhealthy foods less often. And then down at the bottom, you can see that they're preparing food at home more often. So 6 or more days per week to have an evening meal at home increased by about 8%. So really amazing. Next slide, please. Okay, and then this view is the pre and post clinical metrics. So you can see across the left, we have pre stacked on top of post for each clinical metric here. And some of these clinical metrics remained pretty steady, but others we saw really incredible improvements. So if you look at the first one, LDL, those in the optimal range for LDL increased by 6%. We have quite a great improvement in blood pressure. So you can see that we had an increase from 86 people to 121 people in the normal blood pressure range. Amazing. More people were moving into the normal range for A1C, so 5.7 or below. That's great. We had more people in a healthy range for BMI, more people in a healthy range for waist circumference. We had quite a few people lose weight, but we had over 40 people who lost 5% or more weight loss, which is a level of weight loss that's been shown to really improve quality of life and reduce disease risk. So that's really incredible. And then one more slide from me is just overall satisfaction. And based on the washout of green that we have here, you can see that participants just really enjoy the program and are really satisfied overall. So I've been working on creating your site-specific dashboards and sending those out. I've done majority of those. If you haven't heard from me yet, you will be soon. I have just a few more to follow up on so that you can see these dashboards limited to just your participants. If you're a new program for this coming year, we'll do the setup for you, get you set up with an account in RedCap and training and all that. So I will drop my email in the chat so that you all have that to be able to contact me. But thanks everybody. I'm really excited to be a part of another program year. It's a really great program.
Thank you, Andrea. That's so helpful to see those graphics. So I'm going to conclude. We've just got a few more slides here, but we owe it to you to give you an update on the FARMacy West Virginia. We call ourselves a planning team, and we meet. We try to meet monthly. The group of us who work on kind of stabilizing and thinking long term, especially about sustainability funding efforts. So with our team efforts, a journal article has been submitted, and this is really exciting for us. This is something that just says if this is published and this is taken up, this is a really credible. It really like underlines the credibility of what we're doing in rural Appalachia for impacting health metrics for the patients that we find to be the most vulnerable and in need. So that includes the results. If you were participating during the 2020 to 2022, you're in those. You're in that that data that'll be part of that publication. So look forward to it and look for it is our long-term goal and our hope. We also have been part of an ongoing conversation to develop a food as medicine coalition in the state. There are FARMacy West Virginia is a produce prescription program. There are other organizations and entities and groups within the state, folks who have been working on food as medicine initiatives in other avenues and in different ways. And so collectively, we have recently met several times and outlined our long-term goals and kind of like developing more of a concrete plan for a coalition going forward that can truly not be as siloed within the state as some things can be, and gain some traction for, again, long-term sustainability and impact. We continue to work with some of the managed Medicaid insurance groups. As Dr. Carroll mentioned, the Aetna funding is rolling over, and we will be reporting to them and following up and hopefully reporting back to you their pleasant success of what we've been doing with their money and the impact that we've had on not only their members, but across the state. So hopefully that translates to ongoing support. We have, as it stands now, we do desire to have those ongoing conversations at the state level to open Medicaid waiver 1115. As if you've been with us for a couple years, this has been an ongoing discussion. This would allow for essentially coverage of the idea that food is a part of medicine and their healthcare, and this would certainly allow for sustainable funding. Those conversations are still our desire and ongoing. Next slide, Audrey. So what are we asking of you? This is the next step slide and a crucial piece. So if you haven't been paying attention, if you could just tune back in for another minute, we are asking if you are either a new program or a returning program that you email us with your commitment and intention to be involved. This allows us to kind of catch everybody. Instead of us going out and asking and knocking on your door, we need you to let us know if this is something that you're interested in, going around another time. We'd ask that you would email us by February 11th. And again, some of this is about funding and some of this is about utilizing, reallocating funding. And if there were to be other funding that we could put in to other programs or existing programs, we want to be able to get all of that done as quickly as we can in the beginning part of the year. So once we have your email about commitment, we'll email you back and schedule that initial meeting. Again, we want to have all of those players in place to the best of your ability. But if you don't have a farmer grower or an educator, or don't have someone in a clinical position to be responsible for the coordination, we're ready to help you with that. So we're going to work on discussions and circling up to schedule those initial meetings. And what we want to know from you is, how many patients do you think you can serve? What is your capacity? Who are you targeting? We've had some different folks reach out to us, health departments, pharmacies. We want to be able to understand what your mission is and what your vision is about who you want to take care of. So we'd ask that that you come prepared to discuss your participant numbers. Do you have any funding available? How much funding do you perceive needing? If you're considering an expansion, what can we want to know about what your needs are, and what we can understand more about your funding situation. Again, we want to coordinate all those partner pieces. So having everybody together on that call, it matters to us, but hopefully that'll help really make things run more smoothly for your programs, and what marketing materials you're going to need. And again, we can go over all of that when we talk in person. That was a slide on here. You can reference the slide if you need it. Obviously, if you're new to a program, we know you need the whole package. But if you just need a few more brochures, or if you need a new banner, we need to know those things. So again, if you're a brand new site and you're just interested, same thing, we'd ask that you'd email us. You may not know all the answers to the above questions, and when we meet, we can finalize that. But our goal is to have everything in place by mid-February so that we can move forward with not only patient recruitment, but we can be telling farmers numbers and be a little bit more accurate about what we're doing for 2025. And the last slide, Audrey. So again, speaking on behalf of Dr. Carol, Gina, Audrey, and myself, thank you for what you're doing in the state. It really is just exciting to see those 26 counties represented, and all those little orange dots on the map that Andrea provided. This is really what you're already doing. You are working in your communities, and if FARMacy West Virginia is a program that meets your needs and assists with your own efforts to stabilize your community for food security, for nutrition insecurity, chronic disease management, I think these partnerships are very valuable to us, and we are proud to represent what is happening in the state as a grassroots effort to change the trajectory of health for patients who need it. And just really piggyback on the energy that you already have in your communities. So thank you. And I'll turn it back over to Dr. Greco. We appreciate you all being here.
Well, just let me reiterate the fact that we appreciate all of you. We appreciate everyone on this call. It looks like we had up to 68 people on this call at one point, which is amazing. We can answer questions now if it's something immediate that you need to know, or we can wait till we get the individualized meeting set up, which might be more beneficial and fruitful. So again, if somebody has any questions right now and they want to ask, we're happy to do that. Otherwise, we will await your emails to see about your whether or not you want to participate this year, and then we can set up an individual time for you. So if anybody has a question, now's the time.
So Dr. Greco, one thing that I'll ask for us here at Ebenezer Medical Outreach in Huntington, just as a precursor for that site meeting, if there are any best practices that you've gathered from sites for managing no-shows or drop-offs in participation, since we've had the opportunity to be a part of the program 2 or 3 years, that's something that I would really like to see in this next year, that whether that's in that initial selection process or just even how we conduct the program, I'd love to implement some better processes so that we can try to improve our participant retention. So if you already have that information, or if that's something like leading into our call, that's something I'd love for us to put some focus on as a partner to make sure that we're doing the best that we can and optimizing the use of those resources for this new program year.
Sure, that's important. I mean, attrition rate is always an issue. People dropping out or not showing up, obviously, is always an issue. Engagement is part of that, but also the main thing is patient selection. And that's the really the crucial issue, I think, with not having people drop out. Asking the right questions before you select the patients. So we can go over that. Maybe you have some issues that can be addressed at your particular site, and we'd be happy to talk about that when we meet with you. But thanks.
I would add too, this is something that other sites have done. Just the transportation piece is difficult to navigate in many areas. And so stretching the pickup time, allowing other family members to be the liaison for pickup, making sure the location for pickup is accessible, having, in some instances, transportation vouchers for patients if necessary. But again, when we follow up, sometimes it's not transportation in an area like, you're pretty central to your community that you serve. So trying to troubleshooting what is it that patients that kept them from what was the barrier.
Any other questions before we wrap this up? Yeah. Right. The day before. Yeah. Amy Dispersey just mentioned in the chat, day before calls are really important, reminder calls. So, if you can have someone designated to do that, whether it's the community champion or somebody else involved in the program, to call the patient the day before, that's essential for people to show up. So thank you, Amy. Anybody else? Comments or questions?
We have a question. Well,
Mhm.
you had mentioned about doing calls the day before. We ended up actually using a one-call system to where we do weekly calls to our patients the day before for reminders. And that helped improve our attendance.
That's nice. Yeah, that's a great idea. Yes, Annie, yes, we have with this grant funding, sometimes we do have restrictions on participants from year to year, but this year we do not have any restrictions, so they can re-enroll. Anybody else? Okay, so if no more questions, right now, we can certainly answer questions when we set up our individual meetings, but really excited to hear from all of you. And if you can shoot us an email before, February 11th, that would be perfect so that we can get you all scheduled as soon as possible and get 2025 moving. So thank you all for coming today. We are encouraged by the participation. I said at one point we had 68 people on this call, which is wonderful. And so again, thank you to everybody on the call, and we're looking forward to a great 2025. Thank you.
Your computer is not hooked up. Your computer is not hooked up.
My iPad? Yeah, it's the battery.
Is that what that is?